Welcome to TCM Board Formula Series. Today we review Jun Zi Tang, Four Gentlemen Decoction. It belongs to the category Qi-tonic. The herb photograph shows Ren Shen, Panax ginseng root. The fastest memory hook is this: the 4-herb foundation for Spleen Qi deficiency, Qi-tonic, strengthen, drain dampness, and harmonize. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Ren Shen, strongly tonifies source and spleen qi. Bai Zhu, strengthens the spleen and dries dampness. Ling, supports the spleen and leaches dampness. Zhi Gan Cao, augments qi and harmonizes the formula. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Ren Shen. The deputy level is Bai Zhu. The assistants are Ling. The envoy role is Zhi Gan Cao. Together, the formula tonifies qi, strengthens the spleen, drains dampness, and harmonizes the middle. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is spleen and stomach qi deficiency. Look for this clinical picture: fatigue and low voice, poor appetite and loose stools, pale complexion, weak limbs or shortness of breath. The tongue is pale, possibly swollen with teeth marks. The pulse is weak and deficient. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Shen Ling Bai Zhu San a Euro Qi deficiency with more pronounced diarrhea, dampness, and lung weakness. Jun Zi Tang a Euro adds damp phlegm signs such as nausea and copious sputum. Bulletin Zhong Yi Qi Tang a Euro sinking middle qi with prolapse, chronic fever, or bearing down symptoms. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking qi is the main driver. Safety is part of formula knowledge. Classical cautions include: do not use a tonic formula to mask unexplained weight loss, bleeding, persistent vomiting, or progressive weakness. Rich supplementation may worsen acute food stagnation, damp excess, or an unresolved exterior condition. Use verified products because ginseng species and concentrations vary. Modern medication review includes: Asian ginseng may affect blood glucose, sleep, and anticoagulant therapy. Review diabetes and warfarin management. Zhi Gan Cao requires review with diuretics, digoxin, corticosteroids, and potassium-sensitive conditions. Use a verified product, document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1. 4 foundational herbs. Number 2. Spleen Qi deficiency. Number 3. Pale tongue. Number 4. Weak pulse. Number 5. Base of many Qi-tonic formulas. The one-line recall is: the 4-herb foundation for Spleen Qi deficiency, Qi-tonic, strengthen, drain dampness, and harmonize. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Jun Zi Tang. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.